Lisa Hatfield, and I'm the Field Experience Coordinator for the OHSU-PSU School of Public Health. And I want to thank you all for coming, all you students, all the panelists, and anyone interested in learning more about the field experience. Let me just tell you briefly how this came about. I've been in my position since fall term this past year, and I heard from a lot of students, gee, I wish I would have been able to go to something and talk to some people who could tell me more about the field experience and what they experienced. And so this really came out of a request from students that they would like some more guidance with the field experience. And so here we are. And so I appreciate your all being here. I do want to thank, in addition to students and the panelists here for coming, I do want to thank the Dean's Office for supporting this event. And I also want to thank, this is Laura Ehrlich, and she also works for the school, and she helped greatly as well. So thank you, Laura. Like I said, we are recording, and so we will put this online somewhere, make it available for people who weren't able to make it here today in person. I have a sign-up list, so I'm going to pass this around, and if I could get you to put your name down, your email, and also which track you're in. Ask Laura to pass it back. And then on your seats, there are half sheets, and those are evaluation sheets. And so I'd like you to fill those out at the end. If you need to leave early, just quickly fill them out as best as you're able, and then just leave them on the seats, and I'll collect them when we're done, and I'll get this back out and share this information, and hopefully this will guide us for more work in field experience. I would then like to get us started, and so I'm going to ask the panelists, and we have a wonderful group of 7 panelists representing several tracks. I would ask the panelists to introduce themselves, tell us what they're currently doing, whether professionally or academically, and tell us also where they serve their field experience and what they did briefly. And then after that, I'll explain the question format. So who would like to start? Oh, I should say that we have a mic, and if you just pass it around, that would be great.
Why don't you start? Sure. Is it on? Should be. So I'm Jessica Nye. I graduated from the primary care and health disparities track last June. I currently am the maternal and child health program supervisor for Washington County Public Health. What were the other questions you wanted us? Okay. I did my field experience at Children's Village, which is in Yakima, Washington. It is a medical clinic that provides comprehensive care for children with special health care needs. And I was working with the administrative director, and I did a lot of planning. I wrote a lot of reports. We did a lot of work with public health ethics. We did a lot of logic models, and there was a lot of focus on like lean management and that type of stuff. So in a nutshell.
Hi, my name is Kim Repp. I supervise the Research Analytics, Informatics, and Data RAID program at Washington County in Public Health. Houses all the epidemiologists and research analysts at the county. I am an OHSU MPH Epi-Biostats 2011 class, right? I think that's when we finished. Yeah. I did 2 field experiences, one under Dr. Bill Keene at the Oregon Health Authority Acute and Communicable Disease Prevention Program, and one under Dr. Amy Sullivan at the Multnomah County Communicable Disease Program.
Hi, my name is Eva Hawes. I am a community health epidemiologist at Washington County Public Health. I graduated sometime after 2011 at the what was the Epi-Biostats program, which I understand is no longer Epi-Biostats. I did 2 internships, one at Susan G. Komen for the Cure here in downtown Portland, doing community health assessment work, and I did, and that led to an internship at the Oregon State Cancer Registry and working on breast cancer incidents. Did I hit everything? Yes, okay.
Hello, I'm Hannah Heller. I am going to be graduating in June as part of the dual MSW MPH track. So I'm still over at SHAC, where I did my field experience fall and winter terms of this past year. And we have been looking at the smoke and tobacco free policy that's new on campus and doing some research on that and developing a program to help kind of strengthen that policy enforcement as well.
My name is Ian Prey. I'm currently a PhD student in the epidemiology track here at the School of Public Health. I'm in my first year of the PhD. I finished my master's in the MPH program in the Environmental Systems and Human Health track. That was last year, and I did my field experience in the final term of that, so that would have been last spring. I did an international field experience, which I'm happy to answer questions about too. I was in Peru doing work on parasites, disease transmission of a few different parasitic diseases. So there were a lot of challenges that went along with planning an international field experience, and if any of you are interested in that, feel free to ask me questions about it.
Hi, I'm Rebecca Sachs. I completed my MPH in what used to be epibiostats last June, yes. And I am now doing some various research analyst work, some with Jan Boonheinen at OHSU, some with a couple of researchers at George Washington University in DC. I did my field experience with Bonnie Nagel in the neuroscience department, looking at, briefly, different functional neuroimaging differences in kids who emerged early into alcohol use versus those who didn't drink.
I'm Lisa Miller, and I'll be graduating next month in the Primary Healthcare and Health Disparities track at the MPH program. I just finished up my, I called it an internship at OHSU's Richmond Clinic, which is a family medicine, preventive medicine healthcare center in Southeast Portland. And we were, it's still ongoing, actually. The project, hopefully, is still ongoing, and I'm volunteering now. We started a community organizing project to organize patients, staff members, and community members around social determinants of health, using a community organizing model to have the community identify what their priorities are for what to address and what we want to do. They picked housing. That's a big issue, so that's why it's going to be ongoing for a long time.
Thank you very much. So many of you are SVP'd, which I really appreciated, because what you were prompted to do when you did that was to ask a question or make a comment. And so what I did was I took all those questions and comments and I kind of divided them into about 7 themes. And what I would like to do is to ask those 6 or 7 questions of our panelists. Ask a question, have 2 or 3 of them chime in. And respond to the questions. And if you have follow-up questions about that question, please feel free to ask. And we hope at the end of our time with those questions, we'll have enough time for other questions. Does that work out for everyone? Does that work for you? Okay, great. So, and it's kind of in the order of, I put them kind of in the order of how the field experience progresses. So the first question was, how did you prepare for the field experience? And what do you wish you would have known beforehand, now that you're on the other end? Yeah, and if you could pass around the mic, that would be great. Thank you.
Fabulous. So when I did my field experience, we were transitioning to the School of Public Health, and epibiostats was transitioning away from a thesis-based program into the more extended field experience program. So maybe a little abnormal, but before classes started in the program, I actually sat down with Dr. Lambert and talked about my interests, and he gave me some names of various people who I might want to work with, and I contacted them and actually asked the person, Bonnie, who would be my advisor, we talked about some ideas of things that could be done, and then sort of coursework or independent reading and such that I could do to prepare myself, which in this case, I had a pretty good statistics background from the program, but I knew very little about neuroanatomy, so I bought myself a neuroscience book and did that. So I think, at least for me, it was really helpful to talk to my advisor or, preceptor? I don't know what we call them. The person who was running my field experience ahead of time and get some background information that way.
can kind of piggyback off that. My situation is a little rare in that I do 500 hours for my field placement through the School of Social Work. So I've really gotten the chance. I definitely have plenty of time to really get to know SHAC and get to know the agency inside and out and all the partners they work with and the different departments. And I think that has been really beneficial for the specific 200-hour project that I'm working on then for my MPH field experience. Has really just propelled me into knowing who to connect with or kind of just I bounce ideas off of. Yeah, and so I'm there a lot too, so a lot of those conversations happen outside of that 200 hours of time, but in the same guise, just the more you can know about the people you're working with and the directions that you want to be heading in, definitely helpful.
And for those of you who don't know, SHAC is the Student Health and Counseling Center.
So with mine, it was really kind of an opportunity that I just jumped on. I had actually, before we knew we were moving down to Portland, I had applied for a job at Children's Village and I turned it down. And so I ended up calling the person that offered me the job and said, but how about I come work for you for free? And so I kind of really just jumped on that opportunity because it was a really good place to do that. I would say the thing in preparation that I would recommend is that, like, I knew my internship was coming up, but I didn't realize how much paperwork was involved. And because I was out of state also, there was a lot of like legal stuff that they had to go through to make sure that they were able to coordinate together. So I'd say just making sure that you read through all of the documentation that you have about your field experience, what you need to do. There's a checklist, or there was when I was working on it. Going through there, just making sure you have all of your T's crossed and your I's dotted and that you're ready to go, because there's actually a lot to it. I think that was the big thing for me, just the prep work, and it all kind of happened really, really fast. So.
In terms of preparation for the field experience, I started planning mine quite early, and I would recommend that for all of you too, if you have the luxury of doing that. I would say 6 to 8 months before I had a timeline for when I would be going. I was starting to think about the types of skills that I would need in my field experience. And I used, some of you may have taken, there's a course, research design, and I believe is offered in the fall at OHSU, and that was a really helpful course for me to begin planning the research that I would do. I really used that course as a way of mapping out exactly what my research would involve. And then I took some other methods courses. My particular project was a spatial analysis project, and I really needed to develop GIS skills and sort of mapping skills, so I took a course for that with the intention of using those skills for my field experience. So the earlier you have a sense of what type of project you're going to do, the more you can sort of plan your coursework to prepare you for that.
The question was, did anybody work full-time while doing their internship field experience? And I did. And actually, it was a new job. So it was a learning curve at my new job and the learning curve of the internship as well. So fortunately, the project that I was working on wasn't clinic-based. It was a project out of the clinic. So almost all of our work was evenings and weekends, really. So it was just like, our track is completely online, so it was just like everything else I've done in grad school. It's all been whenever I can fit it in the evenings. Yeah. Otherwise, I don't think it would have been doable if it was business hours. Yeah.
Similarly, I have always had like too many jobs and was working, I think, about the equivalent of full-time while doing my internship, and it was awful, but I survived. I know I have at least one friend who did her field experience, I think, in the organization that she worked for, the caveat being it had to be done outside of her paid hours and on something different from what she was working on in her day-to-day. So like, if you're working for a relevant organization, like, I think that's something that you can do, which would probably help.
Thank you. We'll go on to the second question. What are some skills that you learned, and what else did you learn outside of skills?
I can speak to that briefly. So my field experience may be a little unique from others in the sense that I did a original data collection. Many people choose to do a secondary data analysis for their field experience, but I really wanted to have the experience of getting in the field. That's why I decided to do an international experience and collecting my own original data. And I found that to be, if you have the opportunity to do that, which I know not everyone does, if you have the opportunity to design your own project and collect your own data, I found that a very valuable experience, an excellent learning experience in terms of understanding the limitations of data collection and the limitations of your data. Seeing that firsthand was really valuable for me. So that was my main learning experience, I'd say.
I came into my internship as sort of an EPI expert as a student in this group of community members and advocates in an advocacy organization, which was probably, honestly, over my head. One really good skill I learned, though, was how to translate technical EPI concepts to people who maybe don't live in that world, and that was a painful lesson for many weeks. But it's a really critical piece if you do any sort of technical stuff to be able to boil that down in a way that people can understand it and learn from it and actually use it in a way that's not ivory tower. So that was a really good experience for me.
I guess I don't know as though I learned anything new in my field experience, but I would say that what it did is it provided me an opportunity to really go and use the skills that I had learned in my courses in the real world. And so I don't know if I learned anything, but I think just also I had made the transition from, I was working in academia. Actually, I worked part-time while doing my internship. But making that transition from academia over into the healthcare world was really valuable. So maybe I learned some about that, but really it was just practical application of the skills that I had learned in my courses.
I actually have a follow-up question. Did you learn anything about yourselves?
I learned that this was absolutely the place I wanted to be. I loved EPI immediately. I mean, I already did, but it was really doing community-based work and community health assessment that really drew me there, and it really was what I do now for work. So it was really, really valuable for me.
I'll kind of piggyback on both of those thoughts too. Yeah, I really went with this opportunity to really get to know the campus and this community and these student needs and dig into including student voice a bit more in a way that I hadn't got to engage as a student in the past too, so to kind of take that a little bit more removed step as well. Learned a lot about, or definitely just practicing communication on lots of different levels with administrators and outreach with students. Definitely being very conscious of messaging and how that comes across to different folks as well. Yeah, lots of exciting application of the things that we were doing in classes and really seeing how theory-based programming plays out in the real world, and it's not that scary. It's really fun, so.
Thanks. Yeah, that's the first question was, did you learn anything? And I think what I learned mostly was about myself. Two major things. One is the nature of my project was community organizing through relational meetings, which are one-to-one meetings with residents, with patients at the clinic who are disadvantaged. Some of them are homeless, and then with clinic staff. I'm very comfortable in the clinic staff arena. Residents of the community, that's fine. With patients, I was just more nervous. I tend to be pretty introverted, so I was just more nervous about how am I going to make a connection? How can I be there and genuine enough to have people open up to me, not in a vulnerable way, but in just an honest way about what they're interested in. And it turned out, with training, to be relatively easy, and I wasn't expecting that. And it was a really rewarding skill for me to learn and to overcome however many decades of my life I've been really introverted and kind of shy, and realized that, oh, if you have something that you're passionate about, it's a lot easier to talk to other people. The other thing I learned, I wouldn't say I've learned how to be better at this, but I learned that it's an issue for me, is letting go of control in terms of having things come out really well in the way I want them to. That's something that I'm working on.
Sort of piggybacking off of that, I think I've always known I was kind of a type A person, and I like to have control over things. And partially just because things don't always go as planned, but also because of the transition that we were going through to the School of Public Health, there were just a lot of sort of administrative, like, oh, I didn't know I had to do that, didn't know I had to jump through that hoop, or didn't know that paperwork existed when I started my internship, and then it ended up sort of all steamrolling toward the end. But what I did learn how to do was be more flexible and roll with the punches a little bit more. Like, oh, I didn't know I had to do that paperwork, but I do, and technically I was supposed to do it before I started my field experience, but I didn't, so I guess I'll do it now, and just sort of cultivating a sense of positivity around challenges, which, like, sounds really corny and cheesy, but was something I was very bad at, and I'm not saying I'm good at it now, but I'm better at it now.
The next question actually goes along well with that. What were some of the challenges, and then how did you address them during your internship or field experience?
Sorry, can I? Yeah. Again, just not always knowing exactly what the expectations were ahead of time, and some of that was shifting goals of the field experience as I was in process. But I think sitting down and trying to nail down, not just with your field experience supervisor, but also with Lisa or whoever, sort of what do I need to accomplish during this, and what are sort of the expectations and goals of it ahead of time, so that you're not figuring it out midway.
The public health world in Oregon is very small, and the epi world inside the public health world is even smaller. And the CD epi world inside of that is a very select group of people. And what I learned very quickly is the people that I wanted to have internships with do not take interns, ever. And that was not going to be acceptable, so I had to figure a way around that. So I guess what I learned was my father was right, unfortunately. I basically bird dogged to the point of being asked to leave the state building for an internship. It was horrible. Like, it was totally humiliating. And I was like, no, I want to do this. I can do this. I will work 20 hours a week. I'll work on the weekends. I don't care. Like, I pushed so hard to get those internships with the two people that are best known for CD Epi here in Oregon. And that's what ended up actually getting me my job, was those internships with those people. So I would recommend, and the challenge is, if somebody doesn't take interns, don't care about that. You're just going to have to work a lot harder to get that spot, but that probably means it's worth it. So that's what I would recommend.
I would say the biggest challenge for me was in the planning phase and trying to work through administrative difficulties in arranging a field experience that was off campus, and even more so abroad. There wasn't really a system set up to do that when I started. There were very few people who I was aware of who had done that in the past. And so it took a lot of pushing, and I could have easily given up and done a much easier to arrange internship at a local facility. But it was one of my goals coming into this program that I really wanted to get an international field experience. And because that's my goal, to do global health work. So I thought it was really important for me to have that experience. So I kept pushing, and it took almost a year of planning to get it through, and we had to do a number of different administrative, go through a number of different loopholes, planning, setting aside a term in which I wouldn't be taking any courses was difficult too. I had to plan my courses such that I would have a full term available. And working through getting signatures from many different deans and administrators. But ultimately, I was happy that I pushed for it. And if you have enough passion for it and enough drive to do what you want to do, you can find ways to make it work.
I'd say that the challenges that I had there were two main. I'd say the first one had to do with basically jumping into this organization that I knew pretty little about and having to know everything right away. And so there was a lot of time that I spent trying to wrap my head around all of the information that they were giving me and all of that. So just taking time to to relax and to take the time to learn what you need to learn so that you can do the work right the first time, because you don't want to do it wrong and then anyway. So I'd say that was the first one. The second one was time management. At the time, my husband was in medical school and I still had the kids several days a week because they weren't in daycare or school. And then I was also working in another job. So I think I had 3 separate calendars that I was running pretty much all the time. So that was pretty interesting, but it was really just being diligent about time management, making sure that I had everything scheduled. I was able and flexible enough to roll with the punches if something happened or came up that I wasn't expecting. I was able to deal with it. But I'd say those were the 2 big ones, giving yourself time to get used to the organization and the environment, and then also making sure that you're organized.
Do you have suggestions about keeping up with the documentation, journaling, reports, so on?
Well, my recommendation would be to document everything. Save every single email, write everything down, even if you think it's inconsequential. Make sure that you keep everything until you're completely done and you've completely passed your course and you're done. But document everything, 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 everything.
Exactly what I was going to say.
And check in with your advisor regularly or your internship coordinator.
I put my matrix right in front of me, so I saw it every day. So every email I was sending, every meeting I was going to, I was really thinking about, okay, where exactly is this fitting in? How can I speak to this later? Just keeping really, really intense notes of where how those learning activities are coming into fruition in the work that you're doing. Because generating that report at the end of the experience is a very tedious process and is benefited by just as much detail as you can put into it, really showing how you did all those learning those learning activities and how they relate back to that bigger picture. So for me, I'm a very visual person. I just had to have that in front of me every day and really kind of intentionally check in with it every day and keep track of everything.
Technology is your friend. I think I still have my Google Drive folder that has like a giant spreadsheet where I kept track of all my hours and like description of what I did very specifically during each hour or 15-minute block or whatever during my field experience. I didn't have a grid, but I had my like document I wrote up that just was like, here's what I'm going to do during the field experience. And every single activity that I did, I marked sort of which learning objective. So on my giant spreadsheet that had my hours and what activity, I had like numbers, like this was learning objective 1, this was learning objective 5. Because again, that report at the end, it's not challenging in the way that like some coursework can be challenging, but it's really tedious, and if you're not well organized, it can be really difficult because you don't remember all the little minutia of what you did in the day-to-day. And so having it documented somewhere is really nice, and having it up in the cloud somewhere is great because then you're not tied to a particular device.
Great, thank you. A few of you have talked to this already, but how has your field experience influenced your career, as well as was it helpful with finding employment?
So, yes, critically important. And it really led me into the field, the part of epi I was interested in, which is, I think, pretty unique. I mean, a lot of us get into epi school to go do, you know, contagion style CDC epi, and I was not really, that is not my cup of tea. So I really like doing community status, needs assessment, health, big picture stuff. And so I found that that is actually a thing that exists and a world I could move into, and so that was really great. And I actually work with one of the other epidemiologists who worked with me in my field experience today, so that's pretty exciting and fun. Not you.
I only exclusively hire OHSU EPIs. Actually, is that true? No, I've got a 2-lane. Yeah, okay. So I talked about my internship with Bill and Amy, and I had to fight to get those, and I did them overlapping full class load, and then I started at Washington County as an EPI full-time on top of that, so that was a little challenging. But when I was interviewing for the job at Washington County, I have a PhD in microbiology, and I was finishing my MPH in epibiostats. But the requirements for that job were so high, I didn't think didn't stand a chance to get the job. But I applied anyway. And in the second interview, my boss at the time asked me, "Do you know why you're getting this second chance?" And I said, "Nope." And she said, "It's not because you're the best qualified." And I said, "Okay." She said, "It's because the two most notorious difficult to please people in public health have nothing but good things to say about you." And that was Amy and Bill. So I can honestly say that because I selected important internships or field experiences, that's what's got me my job. And I started as the second ever EPI at Washington County, and now I have a team of 5. So it's a very big, important decision, and it can really lead to a successful career path if you choose wisely.
I would say definitely yes, my internship helped me to get my job. Part of it is that I had previously been working in academia, and so I was really making the jump over to public health. And so it allowed me to gain experience in that field and really kind of have the credentials to get my job. It definitely helped. I had a great reference from my preceptor when I got my job. And I mean, I was able to say that I had used those skills in the real world because of my internship. So for sure.
Yeah, my field experience was extremely instrumental in getting me to where I am right now, which is in the PhD program in epidemiology. My PhD mentor currently is Seth O'Neill, who is the preceptor that I worked with during my field experience, and I'm working on basically a continuation of the work that I did during my field experience. And so in terms of introducing me to a content area that I was interested in and decided that was worth pursuing a PhD in, was one benefit. Another benefit was showing my capacity and proving that I could do this kind of work to my mentor, who then offered me a summer job after my after the MPH, and then took me on as a PhD student the following year. And so sort of showing your worth to potential employers or mentors in the future is an important aspect of your field experience.
Mine helped me get the job I have, but not in as direct a way, I think, as people are talking about. I don't work in neuroscience. I mean, it was really fun, and I learned a lot. But what my field experience demonstrated was an ability to learn new things. And also, I realized that I just really like doing data analysis, and content area is almost secondary to me. I'm just kind of a nerd. And that helped. The job I'm doing now was my Jan Boonheinen, who's faculty up at OHSU, was like, "You're really good at data analysis, and I can't wrap my head around how to do this. So here's this project, figure it out." And so it's not like I continued work with the people I did my internship with, but I demonstrated skills and learned what I like in a way that has helped me get the employment that I have now.
Mine was also a more indirect path to the work that I'm doing now. I think partially because I was volunteering for Richmond Clinic prior to the internship when I applied for and got the job that I have now. I work at Care Oregon, which is the health insurance company here. We administer Medicaid and Medicare benefits for a bunch of the CCOs in Oregon. And the reason that my volunteer experience with Richmond was relevant to them is because it was really my first hands-on experience with this population that Care Oregon serves. My prior work experience had all been hospitals with clinics and really not very much patient focused. So having this additional exposure to the Medicaid population that Care Oregon serves was a big piece of how I got a chance to get the interview at Care Oregon.
At what point in the process, so as you're doing your field experience, maybe that's the last thing you have to do before you graduate, at what point in the process would you recommend starting the job search? Would you focus just on finishing up the internship, doing your job there, and then job searching, or what would your recommendation be?
Well, in our field, in EPI, jobs don't come open very often, so I think you got to jump on it regardless of what stage in your life. I think I interviewed when I was very pregnant for my current position, so you just kind of got to go for it when there's jobs open that you're interested in. I think even applying and interviewing, even if you don't get selected or even if you don't get selected for an interview, is still really good and useful information, and you keep that skill current, because if I had to do it now, it would be really rough on me. So I think go for it if you can possibly manage it. I mean, I know it's hard with family and everything you got going on, but I would go for it.
Every internship, every meeting is a job interview. Every single one, and treat it like that. Don't wait till you're done. I mean, start thinking about your jobs. I mean, I selected my internships based on where I thought I wanted to work. Like, so I would recommend going as early as possible to help frame the rest.
I also think it's on an individual basis. I mean, it kind of depends on where you're at. If you want a job immediately when you're done with school, you kind of need to apply earlier. Jobs in public health don't come open, especially decent paying jobs in public health don't come open very often. So if you see one, you need to jump on it, even if you're, a ways out. I'm not even going to tell you how many jobs I applied for because it would be disheartening. But, I mean, our situation was that my husband was starting residency down here, and we found out May 20th that we were moving to the Portland area, and I applied for the job that I got May 21st. And I didn't graduate until, when did we graduate? June? So it really is an individual thing that, depends on your needs.
And I kind of planned mine so that it took place over the fall and winter so that I could kind of leave spring term for more job searching as I'm looking to be hopefully employed very soon. So.
I have a question that I wanted to direct to Lisa just because it might bring out something useful for the rest of the students. Did you work with the IHI to help you get the job that you have now?
Yeah, John is reminded by my branding water bottle here, the Institute for Healthcare Improvement, which you guys might know of. It's an international organization, actually, that first put together the triple aim that many of us are working towards. So we want to improve healthcare to deliver better quality care at a better value with better patient outcomes, better population outcomes. And we have a local PSU and OHSU student chapter of it that I've been involved in for a couple of years now, this year as an officer. And so did that help me get my job? Absolutely. My previous work experience was in process improvement, and that's part of why I was very interested in joining IHI. That was what I was volunteering to do at Richmond Clinic prior to the internship. That was how I really got into Richmond Clinic, to be able to do the internship that developed out of it. And that's what my job is now at Care Oregon, is process improvement. In the pharmacy department, I don't have any pharmacy experience at all, but they needed some process improvement to work with primary care clinics to help them get medications to their patients more efficiently and better. And it is a well-paying job. And in public health, I am one of the only public health people in my department, but that I think that perspective is, I know my manager really values it, and the involvement in the IHI that really put forward the process improvement framework was super helpful in getting there. And if anyone wants to join the chapter, please talk to me afterwards.
Thank you. And your last question from those who RSVP'd, Ian, you spoke to this already. Have you been able to continue your work or research area after the field experience?
I've got the mic, so I'll start with that one. I just finished up in April with my actual 200 hours internship, and my plan all along was to continue volunteering for the project afterwards. Unfortunately, we didn't plan super well for sustainability, so I was taking a leadership role throughout the whole 2 terms that I was doing my internship, and then all of a sudden I say, okay, that's awesome, let me go now. So I can volunteer and have it be voluntary, and we didn't plan for that well enough. So for a little while I was still just by default leading it when my family wanted me back, and I wanted to do other stuff with my time. So we're getting to a point now, it's only been a month and a half, but we're getting to a point now where I'm able to participate as a volunteer rather than having to carry it, because I was doing that for a long time. So I guess the learning out of that is plan for sustainability beforehand, and depending on the nature of the project, stay on as a volunteer, because like we were just talking about, they're great connections and it's good work to have to do.
Let me just add briefly to what I said before about continuing the work that I did. One thing that I found a valuable exercise, which took a lot of extra work, but in the end I was glad I did it, was to carry on with my project and get it published, write it up, and finish it off. And it took a lot of work, and it was very tempting to say that I'm done, I graduated, I have my MPH. I don't really want to deal with this anymore. I'm moving on to other things. But putting that extra work in, it took me many months to continue further analyses and write it up and do the work. But if you can have a publication, especially if you haven't had any publications before, it can help you in different areas. Certainly for me, working into my PhD work, it's helpful to have that publication. Regardless of what field you end up going into, it's always nice to have some work to your name and to have that in writing that you did that project. So I would recommend if you have the opportunity to put in the extra time to finish out the project.
At the time I was in epi school, we had to do an internship and a thesis, and I remember a really good piece of advice I got was try to select something you could foresee yourself doing for many, many more months, and I didn't really quite understand what that meant until I was doing it. So I did my internship in breast cancer, and then I went to Oregon State Cancer Registry and looked at breast cancer, and then I did my thesis in breast cancer research and economic status. So yeah, I got to continue, and it was really great. I mean, I don't get to do breast cancer stuff now, but I think continuing that along, and kind of like what Ian said, is just you really dive into this subject area that you really feel really engaged in it. So it's nice if you can complete that fully.
Outbreak investigations fall under the jurisdiction of our shop at Washington County. So my internships laid the foundation for being able to do that work by being taught by my mentors, Amy and Bill. So certainly that work continues. We have many publications on norovirus and outbreak investigations. I've just been fortunate enough to add a bunch of different things like violent death risk factors. I mean, we've really expanded, but yes, my internships have certainly set the stage, and that work continues today, actually, literally.
I wouldn't say that I'm continuing the work that I was doing directly, but I was working with kids with special health care needs. And so now as the MCH program supervisor in Washington County, I'm working to implement the programs that Cocoon is the program in Oregon that is specifically for kids with special health care needs. But just having that background and actually understanding what that means specifically, I'd say I continued on somewhat. So.
Just sort of building on one or two of the comments, I just wonder if you could speak to other supporter opportunities for presentations, other articles. Were you supported in doing that in school, and how did that play out? Just a little bit around that.
My mentors expected a publication for every project. That was a given to play ball. It was not supported by school or anything like that. Or there were lots of opportunities for presentations, but that level stuff was expected to do on my own.
There was nothing wrong with my field experience or the fact that it was a non-thesis option, but I was a little bit disappointed that we didn't have to write a thesis. Part of that is my husband's influence coming from a hard science background and his thesis writing and doing undergraduate research. But so I actually wish that we had had the opportunity to create a publication, and it wasn't that there wasn't support, it's just that there wasn't really the opportunity or the time to do that. But I think it would be really beneficial to have a class or something that supported that.
I know I think it just happened in April, the student poster showcase, I know was definitely support. I did not participate. Life just did not allow for it, but my place was definitely supportive of that and would have helped with cost. And we would have easily produced a pretty awesome poster, but life did not allow for that this year. That's a great opportunity.
Yeah, sort of piggybacking off of what you said, I was very disappointed that there wasn't a thesis option in the MPH. I ended up not publishing my field experience findings for a variety of reasons. It's neither here nor there, but having the support and the opportunity to have done some sort of major writing project would have been nice. I mean, there are other opportunities for publication for people who want to do like presentations. I've done OPHA a few years for a variety of projects, and that's a pretty low stress meeting that I've always enjoyed presenting at. And they cover a variety of topic areas, so often it's great if you're doing more qualitative or even less sort of numerically driven work. And the student poster showcase is really great. I mean, my field experience advisor really encouraged me to seek out sort of topic area conferences. So in this case, it was neuroscience conferences, because poster presentations are a great way to sort of offer a brief summary of what you're working on without having to go through the full process of writing up a publication.
OPHA even has prizes for student posters. Somebody might have won one last year. And I also shared that same poster at the student showcase and at the IHI National Forum. So same poster, 3 different audiences. My employer paid for me to go to the IHI National Forum, which was lovely. But
Oh, and Research Week.
OHSU Research Week.
Great. We have about 10 minutes for open questions. Do you want the mic?
Oh, no.
I'm told the mic is
No,
supposed
no,
to
it's fine. I
improve
have a
the
loud
recording
voice.
quality.
It's kind of going back to like the beginning process of preparing for it, but for those of you who went away and like took a whole term to do your internship, like how did you go about like preparing your classes, and like was the workload, I mean, like significantly heavier if you added another class, or was it doable?
I can talk to that. Yeah, it was a challenge, but it was doable. I did my MPH full-time in 2 years, more or less full-time. And I was able to, and did my field experience my final term, spring term of the last year of my MPH, and I was able to look at my degree audit and see what courses I need to. And this is what, it helped to plan this far in advance to make sure I could get the courses that I needed, because I really wanted to graduate by spring of last year. I didn't want to take any extra terms that I didn't need. And get the courses that I needed in the summer before the previous summer, and then make sure everything lined up well. But it was definitely doable. It was a challenge, but it wasn't significantly more than, I mean, I did my MPH in, 6 terms, including one term in which I didn't take any courses at OHSU. So it was definitely doable for me, yeah.
When I went through school, they recommended we do it in between our first year and second year. So I think it's similar now that you take a whole year epi and a whole year biostats, and then I took my internship. So I didn't have any other courses. Wait, yes, I did. I had a GIS class, but it was a 6-week intensive class. So it was totally doable. Honestly, it was way, 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 way better than that first year of grad school. That was horrible intenseness. So this was easy. It was like working. I worked way more than the 200 hours we had to do. I think I did like 400 or something because it just kept going. And it's such a good opportunity that you don't want to say, actually, never mind, I was done like 300 hours ago. That's not really the good way to prudence yourself. So yeah, I worked for free for quite some time, but it was great and I would do it all over again.
So I actually did my internship, my MPH program over 3 years because I was also working part-time. But I did take an entire quarter just to do my internship and didn't take any other classes. And actually, if you can do that, I would highly recommend it because it offers you the opportunity to focus on your internship. There's a lot of different pieces. I think I produced probably 5 or 6 multiple, tens of pages reports that, and just trying to focus on all of those things while doing classes would be next to impossible. So if you can swing it, I think it's a great idea to try and just do your internship over 1 quarter. The converse of that is if you can take your internship and do it over multiple quarters while you're taking classes, then you have more time there, but it just really kind of depends on what you're working on. So.
Other questions? I'm curious about how you went about getting your own best experience out of the internship, like how you matched projects that you're interested in with what the organization needed and kind of navigating that.
Well, what I did is I went in because I was working with the director of the organization, and so I went in and we really just sat down and I said, here are my interests, here are my skills, this is what I can do, what do you need done? And so we just came up with a bunch of different projects for me to work on and went from there. There was a lot of organization. They were going through a lean management process at the time, and so just doing a lot of QI and data analysis and stuff. So.
I kind of went about that a little bit backwards. I found the people that I wanted to work with, and I said, I'll do whatever you want me to do, and then build that respect and that trust, and then we started to get to the projects that were really meaningful to me. But that's how I did it.
Mine was a really tight, it was a time-limited project, so I didn't do like a bunch of stuff within the thing, but I did that one project right away, and I don't think I was in quite a position to be like a chooser. So I took whatever anybody gave me and I did it with a smile on my face. And I think that that's a decent attitude to have when you're a student, honestly, is thank you very much. I'm so glad to be here. That positivity and making whatever situation you're in positive because you're being positive about it is really a crucial thing to know. Even, and it carries forward into your career too. Just maintaining positivity within yourself, because really that's the only thing we can control, right?
I feel like I kind of had the best of both worlds in that sense that also, and lots of communication. I was setting up my field experience while I was in Central America last summer, so lots of emails back and forth of, these are my requirements, here's some of my ideas, are there any projects that you think might fit this, and just kind of crafting from there. I also had the luxury of, I'm still at Shack and was there for an additional 500 hours. So kind of some of those other projects or things that would be a little bit more tangential, I was still able to do just in other time as well, so.
Yeah, just briefly, I would echo what a few other people have said in that I really approached it from choosing the person or my mentor or preceptor, however you want to call it, in a very general content area that I wanted to do a global health project. And I found a person that would let me do that in Seth. And after that, I was really happy to do whatever projects he had available for me. And when I look back on what I benefited from this, it wasn't the particular project that I did that could have been really anything. It was developing that relationship with somebody who I valued and I realized could contribute to my professional development. And then we could do now that I'm doing a PhD, we can do more projects that I'm focused on and fit my interests. But initially in the field experience, it's very much about just choosing a person and a setting that's right for you. Yeah.
Yeah, similarly, I went in rather than with, I want to do this specific project, I went in with, I want to learn these skills. So, my first meeting with my advisor went very much like, I'm really into MRI data and I have no idea how to analyze it, and I'd like to learn how to do that. And so what do you need done that would allow me to learn that specific skill? And she was like, oh, perfect. And just like, here's what I need done. And so I got it done for her. And it involved a lot of really tedious work. And I wouldn't say all of it was fun, but it was like useful. And I learned a lot. So I think, again, going in with sort of the student mindset that you're there to learn. And that's the whole purpose of it. Just as much as a class, you're there to learn. This is experiential learning.
One more question? Someone's dying to ask? Oh, sorry.
I just want to add on one thing because we have a never-ending line of interns. It's really annoying when an intern comes and says, I want to do this, not skill sets or anything, but I want to do this project. And I'm like, that's really interesting. Good luck with that. Because it's a tremendous added work to take an intern, to invest in them emotionally, professionally, everything to get them to where they need to be, to have them learn. And if they come in telling me what they want to do, if it doesn't help me, that's a closed door very quickly. So much like what everybody said here, if you want to play ball, get in the door first, right? Don't pick out the game plan before it started, because if I don't see a way to make that fit at all, it's a lot more work for me to take you than it is to not take you. So if I don't see an alignment there, if you're not open, that closes the door.
Well, and I think the other thing to remember is that a lot of the work that we do in our courses, it really doesn't go anywhere. Like if you do a needs assessment in a course, you turn it in and that's it. Nobody ever sees it. It doesn't really mean much of anything. I mean, it's good work, it's good experience, but it doesn't mean a lot. So when I went in and I was doing my field experience, it was really important to me to know that I was doing something that the organization was going to be able to use later. It wasn't just me doing work to turn in. It was work that could contribute to the good of the organization. And so right now I actually have an MPH student that is doing their internship with me. And so that was a conversation that we had today actually. She's like, are you actually going to use this? Am I actually helping you? And I was like, absolutely. You're doing a piece of work that means I don't have to do it and you're able to learn how to do it. And so it's really kind of a mutual thing. You're there to learn, but you're also there to contribute to the organization, and you're there to help the organization to produce something that is going to be used later on. So just keeping that in mind, that it's not just something that you're turning in, it's something that somebody's going to use sometime. So.
Thank you so much. That's wonderful to end on. I appreciate it. I want to thank our panelists again for sharing their perspectives and wisdom and experiences. It was super. Thank you. I want to thank you all for coming. Please fill out the evaluations, and you can leave them on your chair. Thank you. And we have the room if you want to stick around and talk a little bit. Thank you.